Hello everybody and welcome to the Tuesday edition of Video Clips. Last weekend was our conference. It was amazing. Sorry you missed it if you weren't there, but you can still enjoy it on video. We filmed everything, even the breakout sessions. So if you're interested in the lectures, the breakout sessions, the whole 9 yards, it's 3 days worth of videos that include the vaccine panel discussion, the talks delivered by Dr. Suresh Stanzik, who produced Code Blue, Dr. Tom Seyfried, the author of Cancers and Metabolic Disease, Dr. Gracie Yuen, who operates the fasting center here in Ohio, Eileen Kopsaftis, our favorite physical therapist, Beth Pryor, a pharmacist who works here and is working on an health education program for children, Mary Marshall, who heads our weight loss program, and Michelle Cotterman, a nurse who's working on eliminating vaccine mandates here in Ohio, and all the breakout sessions. All these people were involved in breakout sessions. So if you'd like to get those videos or get access to those videos, pampopper@msn.com is the email address. And also keep the inquiries coming in terms of the career inquiries. We have great professional training programs here, and there are lots of opportunities in healthcare these days to be on the right side of healthcare, which we think is informed decision-making, diet and lifestyle change, etc. So do contact me. I'd be happy to speak with you by phone and give you my insights for whatever they're worth and talk to you about our training programs and other things that might be more appropriate depending on what you're interested in doing. Feedback from viewers. I always feature at least one email or comment that I think is interesting enough that it's worth sharing with all of you. So I got an email from a regular viewer who said, how did you decide to become fully plant-based when you have stated that it's all right to consume meat as long as it's organic and wild-caught if it's fish? I also know that you provide this recommendation because you believe people will more easily adopt the diet and will most likely to choose to eliminate meat at some point. But isn't this a bit like saying bad foods in moderation are okay? Also, according to addiction specialists, it's best to fully quit cold turkey. So here's my response. I don't make these recommendations because I think that people won't stop eating meat. I don't think that at all. Nor am I secretly hoping that if people adopt a plant-based diet that they're going to come our direction and give up all animal foods. I do make the recommendations I make, and our dietary guidelines here are very carefully calibrated because there is not one single study that shows that the adoption of a vegan diet is necessary in order to regain or maintain health. It would be scientifically incorrect to state otherwise, and I'm very careful to back up what I say with science. The name of this company is not I want to be like Pam. It's called Wellness Form Health. So I didn't start a company to teach people to do what I do. I started a company to teach people to do what they should do to become the best health that they can be in and to make informed choices. And it would be disingenuous to say that the only choice on the table is to eat a vegan diet. I'm not suggesting bad foods in moderation either. I'm suggesting an eating pattern that has been shown to be a health-promoting diet, both in observational studies, the Okinawans, the Blue Zones, etc., and also in interventional studies. Esselstyn's diet wasn't vegan when it started, and Dr. Ornish and the CHIP program, not vegan programs, but producing spectacular results, published studies for both of those programs, with reversal of coronary artery disease. Dr. Ornish is using his diet with prostate cancer with some interesting preliminary results, and CHIP, I think there are 24 or 25 studies in the medical journals with CHIP as well. So the bottom line is that we're not ideologues here, we're scientists, and we don't want to teach people to do what we do. We want to teach people how to do what's best for them. I would never talk somebody out of adopting a vegan diet, but nor would I present it, and we can help people do it in a healthful way, because I'm sure you know there are a lot of unhealthy vegans out there. Just adopting a vegan diet doesn't make everything go away. So we can help people do it healthfully, but the bottom line is that there are other things that are important for health as well, and being vegan is a choice, it's not a mandate. So one last thing I'll mention is people aren't addicted to meat, and they're not addicted to food. I mean, let's put that aside for a minute. You get a great dopamine rush when you eat food, and the reason is because humans have to do a couple things to survive. We have to have sex in order to perpetuate the species, and we have to eat in order to personally survive. So nature rewards us for doing both of those things. So to suggest that because of that. You're addicted to chicken or something of that nature is just crazy. So you don't have to quit cold turkey eating chicken. You actually don't have to quit at all. You do have to buy better chicken because the factory farm stuff is pretty awful. All right, so today's topic is one that I get a lot of inquiries about. I started looking into it as a result. Some of the questions you send me eventually become video clips and articles that we add to the library. One of the long-term and very debilitating side effects of treatment for cancer patients, particularly breast cancer patients, is chemotherapy-induced peripheral neuropathy, or CIPN. Onset of neuropathy is, in fact, one of the most common reasons why cancer patients just discontinue chemotherapy and think that they can't take it anymore. The symptoms, and you'll understand why when I list them here, include significant pain, burning sensation, loss of reflexes, difficulty walking and climbing stairs, increased risk of falls, and difficulty driving. Some patients become debilitated enough that they have difficulty just maintaining daily activities required for living. Follow-up studies show that the pain can continue for many years after treatment is either discontinued or completed, whichever happens, and many, if not most, patients require medication, a good percentage of them opiate drugs. Now, some types of chemotherapy are more neurotoxic than others, and the ones that are the most concerning are platinum-based drugs, taxanes, vinca alkaloids, thalidomide derivatives, and proteasome inhibitors. Incidence of CIPN ranges from 10 to 100%, and that's a pretty wide range, but it depends on a number of things, including the type of chemotherapy, how many drugs are used, how long it goes on, and also the health status of the patient. Risk factors for both the development of CIPN and worsening of symptoms include older age, being overweight or obese, gaining weight while receiving chemotherapy, and being postmenopausal if female. Patients who are more physically active before diagnosis and continue to be physically active during treatment have less severe symptoms. There are no drugs that really effectively treat CIPN, but there are many effective natural alternatives, thankfully. For example, some but not all studies show that acupuncture is an effective treatment for CIPN. In one study, 40 breast cancer patients who developed CIPN following taxane-containing chemotherapy were randomized to immediate acupuncture or a waitlist control group. At 8 weeks, women in the acupuncture group had significant improvements in neuropathic symptoms, little change in the controls. Studies also show that if you start the acupuncture during chemotherapy, this lessens symptoms and can stop the progression of CIPN. In a phase 2A single-arm trial, 26 stage 1 to 3 breast cancer patients receiving treatment with paclitaxel who had developed grade 2 CIPN were given acupuncture, and none of those 26 patients progressed to stage 3 CIPN while they continued their chemotherapy. A meta-analysis of studies showed that most participants with CIPN improved as a result of acupuncture, and there were no adverse side effects. The authors reported that acupuncture appears to have a dose-dependent effect. More sessions and over a longer period of time improves the outcomes. Limitations of research on acupuncture and CIPN include that in many studies, the improvement is reported subjectively by the participants themselves, but still, not much can go wrong with acupuncture, so that limitation isn't particularly concerning to me in this instance. Exercise is also effective for reducing symptoms. In one study, 355 patients receiving chemotherapy were randomized to chemotherapy alone or chemotherapy plus exercise. The exercise was really reasonable. It wasn't running marathons and bench pressing your weight. It consisted of a moderate intensity home-based 6-week program of walking and resistance training. Patients in the exercise group reported reductions in many things, for example, the sensations of hot and cold in the hands and feet, and reductions in numbness and tingling. Other studies have shown similar results. Yoga is a form of exercise that has been shown to be beneficial for improving CIPN. In one study, 8 patients with CIPN were enrolled in yoga and meditation classes for 8 weeks, and the subjects were also taught how to continue their practice at home. Symptoms improved significantly. Pain was reduced, balance, stability, and self-confidence was improved, fear of falling decreased, and there were no negative side effects. There aren't very many studies that have looked specifically at yoga and CIPN, but the medical literature is full of studies that have looked at the effect of yoga on cancer patients, and it's beneficial in many, many ways, including reducing stress related to having a cancer diagnosis and undergoing treatment. So not a whole lot of reasons not to try yoga. Massage is another option for patients with CIPN. In a 10-week study, including 62 patients with multiple myeloma, 97% had at least 2 CIPN-related symptoms. Most common were numbness and tingling in the feet. After just one massage, 72% of the patients reported improvement, and 47% of the patients said that the improvement lasted until the next massage session. The biggest change was reduction in overall weakness, a 67.5% improvement after just one session. Overall symptoms improved by about 45%. The only thing that didn't get better was the sometimes side effect of ringing in the ears and difficulty hearing. Dietary change, as you might imagine, has been shown to have a positive effect. There isn't a whole lot on CIPN specifically in diet, but I did find one study that showed that consuming whole grains and citrus fruit reduced symptoms while eating highly processed sweet food increased symptoms. Now, we do have quite a bit of research, or not quite a bit, but some studies that deal with, that have addressed the issue of diet and its potential effect on diabetic neuropathy. And the symptoms are very, very similar. One study randomized 15 patients with diabetic neuropathy to either a vegan diet group with B12 supplementation or just B12 supplementation along with the usual diet. The patients eating a vegan diet had significantly greater improvement in McGill pain questionnaire scores than those who just took the B12 supplement and continued on with their usual diet. In another study, 81% of patients with neuropathy eating a low-fat vegan diet for a month had complete pain relief and lost an average of 11 pounds. Now, the diet used in these studies not only was shown to help with neuropathic pain, but also is the same type of diet that improves cancer outcomes and reduces the risk of cancer as well. So the bottom line is that if we were to advise people to incorporate these strategies that I've been describing in this article as at the beginning of treatment, instead of waiting till symptoms appear, we might actually be able to prevent CIPN. I didn't really find studies that showed that, but it just makes sense. And none of the alternatives are toxic, so there's no reason not to try them. And one thing that I'll mention, I didn't find articles showing what happens to patients who have CIPN and then years have gone by and then they've tried to do some of these things. But we have had members here in this situation, a couple of whom were receiving near toxic doses, near fatal doses of chemotherapy in a grotesque experiment that was based on, it's a long story, but it never should have happened. Billions of dollars were spent on this treatment. It turned out to hurt more people than it helped. But one of the side effects of the women who did survive this god-awful experience was neuropathy, and we've had a few of them here as members, and all the things that I talked about here have made a difference and changed the quality of these women's lives incredibly, even if it didn't make all of the symptoms go away. So hopefully this might help somebody who you know who's either going through treatment or has residual negative effects from treatment and might find some relief with these strategies. Okay, that's all for today. As usual, hit the subscribe button if you're not a subscriber. Pass this on to anybody who you think would enjoy watching it, and I will be back to you on Thursday with more news.